Congenital heart defects. Introduction. Can you point to a ventricle? Choose one of the following options. Correct. This is a ventricle. It is bigger and thicker than an atrium. It is responsible for the majority of the pumping action of the heart. Congenital heart defects change the normal flow of blood through the heart. Select true or false. Correct. There are many types of congenital heart defects. All congenital heart defects change the normal flow of blood through the heart. Does smoking during pregnancy cause all congenital heart defects? Select yes or no. Correct. In some cases, the cause of congenital heart defects is unknown. Kate's son, Paul, is 4 years old. He gets tired easily after playing outside and feels like he cannot catch his breath after running. Should Kate take her son to his healthcare provider? Select yes or no. Correct. Getting tired easily after playing and not being able to catch your breath may be a sign of a problem. Kate should contact a healthcare provider. Is surgery always needed to treat congenital heart defects? Select yes or no. Correct. Sometimes surgery is needed to fix congenital heart defects. Other treatments may involve medicines or catheter procedures. Thank you for using Explain.